guys, it's Dr. Carter here at Lexington Podiatry, and we've got some cool nails today. They actually are growing over into his skin, so not so cool for him, unfortunately, but for you guys, they're really neat. So let's get started. I always start over here on the pinky first, just so I don't forget any toes. Of course, it would be easier with these, but every once in a while, I actually do forget which toes I'm on. They kind of break apart. Still don't know how to do that. Okay. And if you can move over here real quick, Tara, if you can see the divot that poor little toenail is making there. So just think, one little false step or somebody stepping on him and that nail can poke right in there and cause a wound. So that's a really important reason to get these clipped. Well, they kind of are brittle and they just flake off on us. Usually the first time we do this, it can be a little bit more sore because he's used to having that protective barrier there and we're trimming it away. So I don't want to be really aggressive, but we have to make sure that he feels better too. All right. And there's some skin that kind of builds up under there. And that's just a reaction to the way that we walk because this part of our toe does hit the ground. They may not look the prettiest this time, but the more we do them, the better they are going to look. And of course it's not cosmetic. That's what pedicures are for. When you come here, it's medical. It's preventing wounds, it's preventing injuries, making sure that there's nothing else going on, especially in diabetics. Usually the big ones are the most fun, but I beg to differ with these. That little one got me.
So how come the big one isn't curling under like the others?
So with your big toe, you're less likely to get a hammer toe in it, which is where the toes kind of bend over anyway. His actually look pretty straight, but when he stands, the toes will bend down slightly to stabilize himself. And that's really just a knee-jerk reaction. He doesn't even know that he's doing it. We all do it. And so I think that's why the big toe just tends to stay a little bit more straight. That was a good question.
Have you seen big toes that do curl over like those small ones?
Yep, they can. So that skin, when I pull it up, it's a little bit attached in there. I'm gonna just put it back down. We're gonna buff over it and I'll put some ointment on it just to make sure. But you know, we've cut it off the other ones and this one just doesn't want us to. So we'll file it down, and as he showers, washes his feet, it will kind of come back to life and it'll be okay. But this is an instance where maybe we'll have some skin sticking out and we can cut the nail down behind it.
Are you tired of living with foot pain or discomfort? It's time to step into relief. At Lexington Podiatry, we're passionate about getting you back on your feet. Don't let another day pass by. Book an appointment with our foot care experts today. Call us now or visit our website. Your feet will thank you.
And as you can imagine, having nails like this would make it difficult to wear shoes, or at least certain shoes. He might just feel like a brand new man when he leaves here. That's our goal anyway. Okay. There we go. We're getting there. Tara's turning our lights off and on and back off again.
How long do you think it took for them to curl like that?
I don't know how to curl.
Or for them to grow so long that they did that?
Yeah, it could be up to a year. Any idea how long it's been since you had them trimmed?
About a year ago.
About a year ago. So, of course, people's toenails grow at different rates. And there are some people that they could go a whole year and never trim their toenails and be perfectly fine. And there are some people that need their toenails trimmed like every other week. So, being a diabetic can for sure slow it down. And so that's why I guessed a year. Oh, geez. We'll see if I can block some of it.
So we do have a lot of people ask if they can buy these nippers. Do you think that's safe for them to use at home on themselves?
Diabetics, no. Big, thick toenails like this, no. If you have little, thin toenails and you're just wanting a professional set of instruments, yes. They can be dangerous. It's hard for me even to clip my own nails using these, just because of the different angles. All right. So there we go. We're going to stop there. I'm going to have the girls Dremel them for me and smooth them down. And each time we do this, we're going to get more and more off. So when you come back and see us in, say, 9 weeks and then 9 additional weeks, they're going to look way better and feel even better than they do now, okay? Perfect. We'll be back.
Hey guys, Dr. Friels here. Let's go over some tips to keep foot fungus at bay this summer. Dry your feet thoroughly, change your socks often, and wear moisture-wicking materials. Of course, don't forget to wear flip-flops in public areas like pools or showers. Now, go enjoy a fungus-free, fun-filled summer. Remember, if you like how-tos, product reviews, lots of patient education, procedure discussions, and shoe shopping guidance, please follow along. Now don't forget, subscribe to our channel and click the bell for notifications.